Go ahead.
So, hello, my name is Shayon Datta. I'm from the Department of Emergency Medicine at Mass General Hospital. And
I'm Chris Moses. I'm a senior at MIT.
And we're with the Moca Mobile project. The purpose of Moca Mobile is to bring healthcare to rural and remote settings around the world. And we do this with an Android application that can be run on a smartphone. The reason that we thought a need existed for this kind of program was because there's such a wide divide between rural and remote clinics and physicians and specialists in big cities and urban centers. And so we wanted to make something that could bridge that gap. Our objective is to make a phone that's open source and has the ability to run procedures that can help community health workers gather patient information and transmit it to a physician.
So what Moca does is it extends healthcare using a cell phone into rural areas that didn't have this access before. So Moca is a Google Android-based system, and it's open source. And what you can do with it is give it to a rural healthcare worker, and they can walk through a list of procedures, one being surgical follow-up. So let's say a patient comes in and do surgical follow-up. They can run through the workflow, gather all the information needed to make a diagnosis, and then it gets sent over the cellular network to OpenMRS, which is an open source medical record system that we're integrated with. A medical specialist on the back end will review the online medical record system, review the medical record, enter the treatment and diagnosis, and send this back to the cell phone in pseudo real time so that the patient can actually receive care while they're still in the clinic.
Great. So what do you guys, so where in the process are you of developing this, and what do you see as some of the next steps for the project?
Yeah, sure. So we actually have a stable of developers right now at MIT as well as the University of the Philippines in Manila, and it's very close to being a ready product for scale. So this January, I'm traveling to the Philippines to actually implement a pilot study, and over the next year, we hopefully want to scale up nationwide.
How do you see this project as different than other telemedicine projects?
Well, I think one of the clear and direct benefits of this kind of project is that it's open source, and that provides a platform that can be built on by other providers and can be tweaked to some specific client's needs, and maintaining the open source kind of belief is something that's a great benefit to everyone in the long run. So I think that's a major benefit.
What do you guys see as kind of the way to fund this project as an open source project?
So we've been running on grant funding so far, and we just raised Series A funding in Manila, and that funding will go to creating a for-profit company that actually customizes the open source platform. So this is just one model of taking an open source system, customizing it, and deploying it nationwide, and using their funding to actually scale up to a nationwide implementation. On our end, we're being funded by MIT, Harvard, and grant funding like Microsoft Research and, let's say, Google.
Okay. What would you say are the largest challenges that the project faces in the near future?
I think one of the biggest challenges, Sean, you can talk about this, is measuring the healthcare outcomes.
Yeah, so one of the things that's very difficult to do is we're trying to implement this Moca platform in places in the world where there's very little health service to begin with. And by doing this, we're adding a service that was never really possible to certain parts of the world. And measuring how that has actually affected patient care, whether it's improved their mortality, whether it's decreased infant mortality, all these kinds of aspects. It's very difficult to measure. It takes a long time, but it's what's going to be needed to show that these are programs that are efficacious and worthwhile to do in the developing world.
Great. Thank you both very much.
Thanks, Doug.